Welcome to the MamasteFit YouTube channel. In this episode, we're going to talk all about whether or not exercising during your pregnancy can cause miscarriage or preterm labor. Hey, for those of you that don't know me, my name is Gina. I'm a perinatal fitness trainer and birth doula, and I'm the founder here at MamasteFit.
And I'm Roxanne. I'm a labor and delivery nurse and a student midwife, and I was dragged into this business by my sister Gina.
MamasteFit is a perinatal fitness training company where we offer prenatal and postpartum fitness training, both for in-person clients here at our in-person training facility located in Aberdeen, North Carolina, and online. So if you're not local to us, you can continue to work with us remotely, wherever you are. And so a big concern that folks have during their first trimester is whether or not exercising during pregnancy, especially in those early weeks, can cause miscarriage. And this may actually prevent you from even starting a workout program in the first trimester. And so I'll have a lot of folks that are like, hey, I want to come work with you, or I want to buy your program, but I'm going to wait until my second trimester to start. And it's really from that fear of if I lift weights or if I run or if I move my body, it can cause a miscarriage. And so to start, exercising does not increase the risk of miscarriage. Miscarriage is a really sad and tragic thing that can happen to about 1 in 4 of us. So about 25% of us have miscarriages. I've had 2 myself. But exercising is not something that contributes towards that. And there's a lot of research that supports this. If anything, exercise may help to decrease issues during your pregnancy. It's not necessarily going to decrease your risk of having a miscarriage, but it's definitely not increasing it.
So the first trimester, the risk of miscarriage is the highest out of the entire length of pregnancy. So there are different reasons for miscarriage to happen within that first trimester. But because of that increased risk of miscarriage just happening, sometimes people just don't want to take on other things, such as like they will say you can't even do a massage during your first trimester. You can't like go walking down the street. You can't work out. You can't eat this or like drink a smoothie because of the risk of miscarriage. But it's not necessarily like if it's going to happen, unfortunately, there's nothing that you can do to prevent it and also to cause it. The biggest reason for miscarriage in that first trimester is because something happens during the development of baby, some sort of issue or a chromosomal issue develops, and that is what is causing the miscarriage, not necessarily because you went to the gym that day.
Another concern with exercising, especially lifting weights, is the fear that it's going to cause your placenta to detach, and that's what causes a miscarriage, and that has not been shown to be true. And so baby is very well protected within your uterus. There's a whole lot of layers of tissue between your baby and the outside world, in addition to that placenta. And so lifting heavy weights has not been shown to cause your placenta to suddenly detach, even like strenuous lifting in the first trimester. So exercising in the first trimester does not cause miscarriage because there's really nothing that you could do to cause one, and there's nothing that you can do to prevent one from happening. And so when they do happen, it's really tragic, it's really sad, and this notion that like you did something to cause it just tends to make things worse. Like maybe you had a miscarriage and someone tells you like, well, you were probably lifting too much, you shouldn't have exercised too much. Well, that's great. Now I feel like shit. Thank you. And so this notion that exercising in the first trimester can cause a miscarriage is hurtful, and it doesn't help anybody. In addition, a lot of the benefits of prenatal exercise start in the first trimester, such as your placenta development. When you start lifting weights and you start exercising in the first trimester, it can enhance the volume of your placenta, which can increase its functional capacity. And our placenta is a really big deal. It does a lot of stuff for our babies. And so if we can improve the function of it, it's only going to benefit both you and your baby throughout your pregnancy. And there's so many benefits from prenatal fitness that we break down way more in our blog and in other videos. But there's a lot of benefits for prenatal fitness, and the risk does not involve miscarriage.
So even the governing bodies of OBs, so ACOG is the governing bodies here in America, recommend 150 minutes of moderate intensity exercise every week. So if they think that exercise is going to cause a miscarriage, why would they recommend somebody to work out 150 minutes a week during their pregnancy for them to have an optimal pregnancy?
They also recommend lifting weights.
Yeah.
Which, again, if it wasn't safe, they would not be recommending it.
Why would they recommend it if it wasn't safe?
So the other concern about exercising during pregnancy is going to be the later half of pregnancy, of whether or not exercising causes preterm labor. And so at the beginning, everyone's really concerned about it causing miscarriage. It doesn't. And then at the end, they're very concerned about exercising causing preterm labor. And so again, Exercise is not associated with preterm labor. There's a lot of other complications that could contribute towards preterm labor. But I think this myth may come from the notion of if you are in preterm labor, you may be prescribed bed rest, which is where you just lay in bed, because the thought is if you keep moving, it's going to increase the risk of that preterm labor continuing. Bed rest has also not been shown to decrease the risk of preterm labor continuing, and if anything, the inactivity can be problematic because it contributes towards a deconditioned state, which can, one, make it harder for you to move through labor. It can contribute towards discomfort during pregnancy, and then make it even harder to recover postpartum. Inactivity can increase blood clots, which, again, not a great thing. We don't want that to happen.
And you're already at an increased risk of blood clots forming during pregnancy.
And so exercising during pregnancy is also not going to cause preterm labor. And I think that comes again from the bed rest, which also does not help prevent preterm labor either. So inactivity doesn't help prevent preterm labor. And so activity would also not cause it. And there's lots of research that supports both of these statements as well. And we'll link the research studies in the show notes. So in conclusion, exercising during your pregnancy is incredibly beneficial for both you and for your baby, but there's a lot of misconceptions out there that can make it really scary. And so you can feel confident in knowing that exercising in the first trimester or really any point during your pregnancy is not going to cause a miscarriage and it's not going to contribute towards preterm labor. There's other things that contribute towards those things that are not related to exercising. Exercise is going to make you feel more comfortable during your pregnancy. It can help you be pain-free during your pregnancy, help you feel more functional and strong. It's going to contribute towards a more positive birth experience because you're going to be able to move a lot more, which can enhance your experience, and it's going to help you recover easier in the postpartum. So tons of benefits for prenatal fitness, and the risks do not include miscarriage, and they do not include preterm labor. So feel confident in knowing that. If you want more support during your pregnancy, check out our online prenatal fitness programs. If you're local to us here in Aberdeen, North Carolina, we're located pretty close to Fort Liberty. Come check us out in person and work with us. With our online fitness programs, we have our 40-week program, which is going to be in the Team Builder app. This is going to be a list of exercises with short demo videos that you can follow along at your own pace. This is going to be a more traditional style of workout delivery. So if you like to work out at a gym, this is going to be a great program for you, especially if you want to continue to lift with a barbell. We have a full-length version and a mini version depending on the amount of time that you have. And then we also have an on-demand program if you prefer to watch a video as you work out at the same time. And so you can get a free sample of all three programs to figure out which one is the best fit for you, and we'll link it down in our show notes, or you can just check out our programs if you feel pretty confident on which one's best for you at mamastefit.com/fitness-programs. And again, we'll link them below. In addition, we also have our childbirth education course where you can learn all about the science of birth. And so we like to break down things for you so that you can feel confident navigating your birth experience as well.
If you want to check out any of those courses, you can use code YouTube10 for 10% off as a thank you for watching this video. And if you enjoyed this video, please like and subscribe to our channel to be notified when we release new videos. If there's a specific birth-related or fitness-related topic that you want us to discuss, just leave a comment below and we'll try to get it done.
Or if you have a myth that you want busted about prenatal fitness, we're happy to do that as well. So thanks for watching. We'll catch you next time.